Hey guys, what's going on? This is Jason DeRose. I'm out here in Clark County. I'm going to be working with Holdfast Nevada and Restoration for Recovery. And I'm going to go over this little case study because I'm practicing it. First, every Saturday at Shine a Light, if you're there by 7:15, they go out and they feed and they do outreach. So if anybody wants to volunteer, first they just get with Shine a Light. Ask for anybody there. It's Saturday, just show up and you'll get thrown in a car. Every first Saturday, you can contact Creation for Cause on their website and volunteer for the Care Fair at 204 Master Lane. The wash is there, Best Buddies, Street Dogs, all that. And then on the second Saturday at the courtyard by Catholic Charities is it's a great event. Do they get food? Do they get clothes? Absolutely. But the DMV's there, insurance is there, and it's nice to see part of the solution, especially to where the courtyard is. I was supposed to go last week, but my father-in-law had his prostate out and he came back from Los Angeles a day early. I had to cancel all my plans. I apologize for everybody on that. But right now I want to talk about our assignment, and I just want to practice. It's for Maria Isabel. She's a client. She's 57 from Guatemala. She lives in Carson City. Her health issues recently she's had a fever and she's had a sore throat. It's improving, but she also has a chronic diabetes, and she takes metformin. I don't know if I said that right. But one thing that I did notice, the barriers that she has is she was living at a place for 20 years. That's getting pulled out from underneath her. And remember, 75% of the population is one major financial crisis away from being homeless. And what's the definition of homeless? Rob Banghart from Shine a Light sums it up the best. You're not on the lease. You're homeless, you know? But anyway, income, because the restaurant's slow and she's sick. She also has transportation issues. She needs healthcare access, so we're probably going to have to, maybe a bus to the primary care is a little much, so we might have to get her a cab voucher like we studied earlier. And then the support system, her son helps her, but he's limited. He's got a life of his own. She has some other kids in Florida. So basically an emotional stress too. Her husband just passed away, and she has, I'm sure that gave her massive anxiety. So I believe that as a CHW, what I can do with the help of the team that I'm with is help schedule a doctor's appointment, reinforce medication adherence, especially with how you can get it delivered now. So we would probably have to focus a lot on the telehealth, and really, it's really easy. You know, I'm actually, with our organization, we're trying to get with Walmart right now, and people that are underprivileged, we're trying to get their medications delivered. Linked to housing resources as well, because like I said, she's about to lose her house that she's been staying at for 20 years. So I mean, this woman's really going through it. She really needs someone to be there and just say, hey, you know, I got your back. We'll get through this together. Coordinate language and interpreter if we need to. Maintain constant follow-up and update contact info. That's key. Basically, our mindset, just follow your organization's blueprint. How they handle it, handle it. Stay professional, structured, and consistent. Focus on what you can control. Communication, follow-up, resource connection. Accept what you can't control too. And don't let that eat you up, because I know it's hard. You know, just like how awesome it is when I see people succeed. Like we had a gentleman straight from the streets in the courtyard who got his ID, got his insurance, got clothes, and now the Catholic Charities, when I was homeless in there, it was a demilitarized zone. You know what I'm saying? Like we were just drug zombies at that courtyard. Now they have prescription services, mail services, constant surveillance. There's security everywhere. It's a safe place. And if you're really working and trying to get on your feet, like we got this guy I met, got him up, put him through the same temp agency that I did when I got out of Southern Desert, and now he's working. You know what I mean? So it's like, it's cool when you see the lights come on, but we also are going to have to be able to know that what we can't control, we can't let that tear us up. So basically, that's all I got. So if you guys have any kind of advice or pointers, especially you that have been in working as a professional, because I've just, I came up from the tunnels, prison, started an organization, went to sober living, Crossroads, all that. So that's where my passion came from. I use my powers for good now. So remember, this is Jason. Thank you. Man, I was nervous on that.